Welcome to your deep dive. We've got a really fascinating pile of research here, all about personality disorders. We're going to be taking a deep dive into some excerpts from Personality Disorders, the volume edited by Maj, Akiskal, Mezzich, and Okasha.
Yeah. It's
Oh,
a pretty dense academic book, so we're here to kind of unpack it all and make it more accessible.
I think that's great because I took a look at it and wow,
It's a lot.
yeah, there's a lot there.
Yeah.
And these excerpts, they really take us from like historical views of personality disorders to how they're diagnosed and treated today,
Right.
like the whole gamut.
Exactly. Yeah. And
Yeah.
it's a super complex field, so our goal is to really highlight, the most important stuff for you, our listeners.
Yeah, I mean, what's interesting to me is that the book actually points out that people with personality disorders often do not seek psychiatric treatment for the traits and characteristics that define the disorders.
Hmm.
I mean, how do you even begin to study and treat something that people don't even see as a problem?
Yeah. It's a huge challenge. I mean, that's one of the biggest challenges in this field.
Yeah.
And it makes you wonder, like, about what a disorder even is.
Right.
Is it just being different? Is it causing distress? Is it causing impairment? And who even decides?
Yeah, it's like trying to tell someone, where to go when they don't realize that they're lost.
Exactly.
It makes me think of some of the old terms that we don't really use anymore, like schizoidia.
Right.
That's like not even in the DSM anymore.
That schizoid, yeah, that's a term that was used back in the early 20th century. And it was basically this cluster of traits like social detachment, being eccentric. Like think of somebody who's really solitary. They don't show a lot of emotion. They seem aloof or kind of cold. And it's so interesting how those concepts, how they've morphed over time.
Well, and they talk about this psychosthetic proportion
Yes.
that people with, schizophrenia could be both hypo and hypersensitive,
Right,
like undersensitive and oversensitive.
right.
And there's this amazing quote. It is essential, therefore, not to overlook a deeper level of extreme sensitivity, the constantly wounded mimosa-like nature of the schizoid.
Yeah.
And that is such a vivid image.
It really is, yeah. And it challenges that stereotype, that we were just talking about, of the schizoid person being really cold and unfeeling, because underneath there's this vulnerability that's often totally missed.
Right. And
Anyway.
so this whole concept of schizoidia, it kind of paved the way for how we understand schizoid and schizotypal personality disorders today.
Exactly.
And the book also talks about this study, the Copenhagen high-risk study. It followed a group of children who were considered, high risk for developing schizophrenia, and they found that some specific things in adolescence were really strong predictors of who ended up actually developing schizophrenia spectrum disorders later in life.
Right.
And those were disorders of affect and emotional rapport, isolation, and subtle formal thought disorder. I mean, that really emphasizes the connection between certain personality traits and the risk of developing some pretty serious mental illnesses.
Right. Imagine a teenager who just doesn't connect well emotionally. They like to be alone, and they have these subtle thought problems.
Yeah.
Those are really important signs to pick up on.
Yeah. It makes you think about the whole spectrum, right?
Right.
From these kind of mild personality quirks
Yeah.
to more severe conditions.
Right.
And the book also talks about all these different scales researchers use to actually measure schizotypal traits,
Yeah.
like the perceptual aberration scale and the magical ideation scale. I mean, makes you wonder how you would score.
It's kind of fascinating, right?
Yeah.
But it's important to remember those are just tools to understand personality better.
Right.
We don't want to use them to just label people or put them in boxes.
Yeah, right. And speaking of those other personality disorders, the book mentions that research on paranoid and schizoid personality disorders is really lagging behind research on schizotypal personality disorder. They just say flat out, PMCD and STPD are simply understudied.
Yeah.
I wonder why. Why haven't these conditions gotten as much attention?
That is a good question. Maybe they're just not as common, or maybe they're harder to diagnose, or maybe they're just, I don't know, maybe they haven't captured the attention of researchers the way some of the other kind of more dramatic personality disorders have.
Speaking of dramatic, let's talk about antisocial personality disorder.
Oof.
I mean, it's a diagnosis with so much stigma. Even the name has changed over time.
Right.
We've gone from moral insanity to psychopathic inferiority to psychopath, sociopath, and finally, antisocial personality disorder.
Yeah.
It's like we've been trying to find the right words to describe these behaviors without really understanding them.
I think you're absolutely right. It reflects both our growing knowledge of the disorder, but also the fear and judgment that surround it.
Right.
And I think it's really interesting to think about how the label itself might actually make the stigma worse.
Totally. The book goes into Corninger's multidimensional model of personality as a way to understand ASPD.
Yeah.
And it suggests that different combinations of like temperament and character development can actually lead to similar behavioral outcomes.
Exactly. Which means that two people might do the same things, but for totally different reasons.
Right. Which has huge implications for how you might try to treat someone.
Absolutely, yeah. A one-size-fits-all approach just isn't going to cut it.
That's
You
right.
really got to look at the individual's temperament, their developmental history, and create a plan that's actually tailored to them.
Yeah, that makes sense. And Corninger also did research on detailed structure of thought in people with ASPD, and he talks about the coherence of character functions, so how integrated basically a person's thoughts, feelings, and actions are. And I'm guessing that that coherence is often missing in people with ASPD.
Yeah, their thinking tends to be pretty impulsive and disconnected from their emotions and long-term goals.
Right.
So they might not fully grasp the consequences of what they're doing or feel bad about it. But here's where things get really interesting. The book mentions these powerful situations that can actually cause ASPD to go into remission.
Powerful situations. What does that even mean?
Like
Flo?
getting married, having a religious conversion, or finding work that they really find fulfilling. These seemingly ordinary events can have a huge impact on people with ASPD, leading to positive changes in their behavior and how they see the world.
That's so surprising. I mean, we tend to think of ASPD as this like deeply ingrained, practically unchangeable condition, but that suggests that even those really ingrained patterns can change under the right circumstances.
Yeah, I think it challenges the idea that it's a life sentence.
Yeah.
It gives people hope, personal growth and change. They're possible, even for people who have struggled with some pretty big behavioral challenges.
It makes you wonder what it is about those situations that makes them so transformative. Is
Right.
it the structure and support they provide?
Right.
The sense of belonging, the purpose?
Yeah, all good questions. And while the book doesn't really go into detail on that, it's definitely something worth looking into more. It really points to the need to understand ASPD in a more nuanced way.
Absolutely. I mean, this has been fascinating, just even this first little bit. What other intriguing personality types will we be covering in our deep dive today?
Oh, there's plenty more to come.
So we've talked about schizoid personality disorder and antisocial personality disorder.
Mhm.
What about borderline personality disorder? That seems like it gets a lot of attention, but not always in a, helpful way.
Yeah, borderline personality disorder, or BPD, it's a diagnosis that has really changed a lot over the years. It used to be seen as this kind of like borderline state between neurosis and psychosis,
Mhm.
often linked to like schizophrenia.
But now it's seen more through the lens of mood disorders,
Mhm.
right?
Exactly. Yeah, so today the focus is really on those intense emotions, the impulsivity, the rocky relationships that are so typical of BPD. And, what's interesting is the book says that a lot of BPD patients are also diagnosed with other personality disorders in that dramatic cluster, especially histrionic personality disorder, or HPD.
Oh, so BPD and HPD often go together. Speaking of HPD, the book talks about how it came from that old term hysteric.
Right.
And it's interesting that the modern HPD criteria actually describe a much more dysfunctional group than those old school hysterics.
It's true. Yeah, the classic hysteric might have been dramatic and attention-seeking,
Right.
but, they were often pretty functional in their everyday lives.
Right.
Whereas the modern HPD diagnosis really captures a more severe level of impairment, with things like these intense emotional outbursts, this constant need for approval, and trouble keeping relationships stable.
So like they took all those dramatic tendencies and just cranked them up.
In a way, yeah. And it makes you wonder, what's considered normal when it comes to expressing emotions, and what crosses the line into being a disorder? Like, where do we draw that line, and who gets to decide?
Yeah, that's a good question. What about, the long-term outlook for people with BPD? I mean, the book actually mentions some pretty remarkable findings from follow-up studies.
Yeah, the findings were actually pretty encouraging. One study found that 10 to 25 years later, about 2/3 of BPD patients were functioning at a level that's considered, relatively stable.
Okay.
So they might have had some mild symptoms, but they were doing okay. They were able to maintain relationships.
Wow, that's really hopeful. It challenges the idea that BPD is this, chronic and debilitating condition. What seemed to help those people have a more positive outcome.
Well, a study found that certain strengths and coping mechanisms seem to be linked with doing better. Things like intelligence, self-discipline, even things like artistic talent and attractiveness. And for those who also struggled with alcohol abuse, being committed to Alcoholics Anonymous seemed to be a protective factor.
Hmm. It's interesting that those things, which, some people might even consider superficial, could actually play a role in someone's recovery. It really shows how complicated personality is
Right.
and how different factors all sort of work together. What about treatment? Are there therapies that have been shown to be effective for BPD?
There are a few that have shown some promise. Dialectical behavior therapy, or DBT, is probably the most famous.
Yeah.
It focuses on, teaching skills for managing emotions, dealing with distress, and improving relationship.
Right. I've heard good things about DBT. Are there any other approaches that are used?
Yeah, there's also transference-focused psychotherapy, or TFP. It's a more psychodynamic approach that kind of digs into the unconscious patterns and relationship dynamics that often contribute to BPD. And then there's mentalization-based therapy, or MBT, which helps patients develop a better understanding of their own mental states as well as those of other people.
So it sounds like there are a few different ways to approach treating BPD, each with its own unique perspective. It's like having, a toolbox full of different tools. You pick the right one for the job.
Yeah, exactly. And the best approach often depends on, the individual patient and what they need, as well as the therapist's skills and what they specialize in. There's no one-size-fits-all solution.
Let's change gears a bit and talk about narcissistic personality disorder, or NPD.
Okay.
I mean, this is one that gets a lot of airtime, especially in pop culture, but I'm guessing it's more than just, being self-centered.
Yeah, NPD is definitely way more complex than the stereotype. It involves this pervasive pattern of grandiosity, needing admiration, and lacking empathy. But within that, there are these subtypes that might surprise you.
Oh, like what?
Well, there's the classic grandiose narcissist, the one we usually picture, but then there's also the shy
A
narcissist.
shy narcissist. That's not what I would have imagined. What's that like?
So instead of being, outwardly boastful and attention-seeking, the shy narcissist might actually seem inhibited, even unassuming.
Huh.
They still have that underlying sense of grandiosity and entitlement, but they express it in these subtler, less direct ways.
Okay, that challenges my assumptions about narcissism. Do they even know how grandiose they are? And how do they square that with seeming so shy?
Yeah, those are great questions. And, it shows just how complex personality is. It's not always so clear-cut. There can be a lot of nuance and variation within these diagnostic categories.
It's like peeling back the layers of an onion. There's always more to discover. The book also mentions different theoretical perspectives on NPD. Can you tell us a bit more about those?
Sure, Kernberg, Kohut, and Millen, they all made huge contributions to our understanding of NPD. Kernberg focused on aggression and envy as central to narcissism. Kohut really emphasized early childhood and developing a healthy sense of self. And Millen saw narcissism as a way of compensating for feeling inadequate.
So each theorist gives us a different lens to view NPD through, highlighting different aspects of its development and how it shows up in different people.
Exactly. And by looking at those different perspectives, we can get a more complete understanding. It's not about picking one theory over another. It's more about bringing them together to create this, richer picture.
It's like putting together different pieces of a puzzle. How do clinicians usually go about assessing for NPD?
There are a few methods, like clinical interviews and self-report measures like the Narcissistic Personality Inventory, or NPI.
But are those self-report measures really accurate when it comes to personality? Especially with something like narcissism where, not being self-aware is a big part of it.
That's a really good point. Self-report measures definitely have their limitations, especially with disorders that involve, like, distortions in how you see yourself. That's why it's so crucial to do a thorough clinical evaluation, to gather information from multiple sources and get a clearer understanding of the person's personality and how they're functioning.
So we've talked about the dramatic cluster and a bit about the odd cluster. What about the anxious cluster of personality disorders?
Oh, yeah, that's a great transition. The anxious cluster includes disorders like avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. And, these often fly under the radar. But they're actually incredibly common and can have a huge impact on people's lives.
Yeah, the anxious cluster. It's not quite as catchy a name as the others, but I bet we all know someone who fits the description.
Probably, yeah.
The book mentions that these are actually the most common personality disorders, but they get way less research.
Right.
Why do you think that is?
It's strange, isn't it? I mean, one possibility is that the symptoms often look a lot like anxiety disorders or mood disorders. So it can be hard to tell where the personality traits end and, an actual clinical syndrome begins.
Like a diagnostic puzzle.
Yeah, exactly. Yeah. And that can make treatment tricky. The book even says that the presence of a personality disorder impairs response to treatment for a wide range of interventions.
Oh, so someone with like an underlying personality disorder might have a tougher time getting better if they're being treated for, say, anxiety or depression.
Right.
That's a huge insight.
Yeah, it really shows how important it is to do a really thorough assessment and look at both personality and, whatever symptoms the person is struggling with.
Yeah,
Because treatment has to address the whole person, not just like isolated symptoms.
I see. So what kinds of treatments are usually used for these anxious cluster personality disorders?
Well, both medication and therapy can be useful.
Okay.
Antidepressants and anti-anxiety meds, they can help with some of the more difficult symptoms.
Right.
And therapies like cognitive behavioral therapy or CBT can help people challenge those negative thought patterns and develop better coping skills.
So it sounds like, a multi-pronged approach is often best. But let's zoom out a bit and talk about the bigger picture for a second.
Okay.
The book brings up some really interesting questions about the future of diagnosing personality disorders.
Yeah, it does.
And it seems like, right now, the system is mostly categorical. You either have a disorder or you don't.
Right.
But there's this growing awareness that personality traits actually exist on a spectrum.
Exactly. Yeah.
So maybe these dimensional approaches, like the five-factor model or FFM, might be a more accurate, more nuanced way to understand personality.
There might be.
I mean, we could probably do a whole deep dive just on the FFM,
Yeah, we could.
those 5 basic dimensions of personality. But how does that apply to personality disorders?
Well, the idea is that maybe personality disorders are just like extreme versions of these 5 dimensions.
I see.
So, for instance, someone with avoidant personality disorder might score really high on neuroticism, but really low on extroversion.
So instead of these black and white categories,
Right.
we start to see personality as this tapestry of traits.
Yeah.
Each one falling somewhere along a continuum.
Exactly.
It's much more fluid and individualized.
It is. And that changes how we think about treatment. So instead of trying to cure a disorder, the focus might be more on helping people understand their own unique personality profiles
Okay.
and come up with strategies to manage the challenges that those specific traits might bring.
So it's more of a strengths-based approach, recognizing that even the so-called negative personality traits might have their good sides. It's like learning to work with what you've got.
Exactly. And, the book makes this great point. It says that personality status fluctuates both in the short term and in the longer term.
Oh, so even those really deeply ingrained personality patterns, they can still change over time.
Yeah, they can.
That's pretty hopeful, right?
It is. It really is. Because at the end of the day, this whole exploration of personality disorders, it's not just about, understanding diagnoses. It's about understanding ourselves, our strengths, our vulnerabilities, and our potential to grow and change.
This deep dive has been so eye-opening. I feel like I'm seeing people in my own life, and maybe even myself, in a whole new light.
That's fantastic to hear.
Yeah, it's a really complex topic.
It is.
But understanding those nuances of personality, I think it can help us be more empathetic and have more insightful interactions.
Absolutely. And it's key to remember that diagnoses, they're just labels.
Right.
They don't define a person, and they definitely don't limit their potential.
That's so true.
Huh.
Well, we hope this has given our listeners a little more insight into personality disorders and made them curious to learn more.
Yeah, I hope so too.
Maybe this deep dive will even spark some more reflection. We often talk about personality traits as if they're set in stone. But what if they're more fluid than we think? What if, with some self-awareness and effort, we can actually shift those traits in ways that are more helpful?
That's a great question.
It's something to think about as we continue on our own journeys. Thanks for taking this deep dive with us.
Thanks for having me.